Hello, I'm Lesley Berkeyheiser with DirectTrust. I'm so excited to be here today to have Laura McCrary, who is the president and CEO of KONZA Health, with us, talking about proving security and compliance with trust at the core. Welcome, Laura.
Thank you, Leslie.
Would you like to very briefly describe KONZA and your role there?
Certainly. My name's Laura McCrary, and I'm the president and CEO at KONZA Health. I've been the president here since its inception in 2010. So KONZA started out as a traditional health information exchange as a part of the American Recovery and Reinvestment Act, and grew over time outside of the state of Kansas into 10 other states across the nation. So we've been providing health information exchange and related services like alerting and analytics to providers and to health plans for the last 15 years. So over that period of time, we've grown considerably from a little company with 2 employees, myself and one other person, to a large company with almost 50 employees today. So I'm excited to spend a little bit of time with Lesley talking to you today about the importance of privacy and security and how we take that very, very seriously at KONZA Health.
Thank you. And I noted this morning and preparing for our discussion that you've been accredited by ENAC Direct Trust since 2021 and High
Yeah.
Trust certified as well with our organization. So thank you. So today we're talking about accreditation trust and how accreditation and certification proves security and compliance in ways that payers and partners and third parties can rely on. Where accreditation allows you to meet the standards, such as HIPAA and high tech and some of the NIST cybersecurity framework, et cetera, it's to prove trustworthiness and real world assurance. So for KONZA Health, when you talk with your payers or partners, why does being Direct Trust accredited matter?
I think that any sort of data exchange modalities are based upon trust. And organizations work very hard to make sure that they have appropriate trust paperwork in place, whether it's participation agreements, business associate agreements, terms and conditions, participant profiles, data sharing agreements. We work very, very hard. But all those data sharing agreements really are all in support of the technical infrastructure that's necessary in order to be able to make sure that our participants, our customers, whether it's patients or whether it's providers or whether it's health plans, that all of them know that we have paid to the highest level of attention our infrastructure to be able to ensure that they can feel comfortable that we've done everything we can to properly secure their data. This data is not owned by us. It's simply, we are a steward of it until the time that it's needed for the patient themselves. And so they need to know that it's properly secured. So interestingly, this morning, I was working on filling out security paperwork for a health plan that we are just beginning to work with. And health plan security programs have become very, very aggressive and require a significant amount of documentation and a significant amount of attention. Being able to have the direct trust accreditations, both through ENAC and through High Trust, has made it at least relatively simpler for us to complete that level of documentation. So for example, today I was able to simply upload our High Trust final report and our ENAC Direct Trust final report into the health plan's web portal so that they could actually review it themselves rather than having to go through a series of Q&A with me or with our security team. But it is part of an overall security posture that we have that also includes doing penetration testing, both internal and external, because that's what's required as a part of our QHIN accreditation under TEFCA. So KONZA is one of the 10 QHINs that are accredited nationwide to be able to share information. And that requires a very high level of security compliance, including high trust accreditation on an annual basis. And in addition to that, ongoing penetration testing, cybersecurity. And so these things are all critically important to think about as a part of an overall security package. And the accreditation from DirectTrust is sort of the cornerstones to make sure that everything else moves smoothly along.
Thank you. And those are excellent examples of practical ways you've been able to use your accreditation and certification reports to demonstrate trust to others. If you think back perhaps when you first gained accreditation in 2021, or even as you go through the process every other year from that time moving forward, is there anything internally that may have changed, such as monitoring activities or policies and procedures, or maybe incident playbooks? Anything that you'd like to share as a practical example of something that actually happened because of the accreditation process?
Well, I would say all of our internal policies and processes and procedures have changed. Probably nothing is the same as it was in 2021 when we first started going through this accreditation. Honestly, we had been functioning as a health information exchange for many years, and we thought we had covered all of our security bases. But when we started going through accreditation, we realized there was so much more that we had not given any, really, we had not given any thought to. And I don't think that without going through accreditation, we would have understood what was going to be required for us to be compliant and to really be able to protect the security of the data that we're responsible for. And it's not just your technology infrastructure, it's also your governance structure, your data sharing infrastructure, the way that you actually manage your employees to make sure that they really have the training that they need and they have the ongoing support and assistance to get more training. And that when you're onboarding employees, that you make sure that you have sufficient background checks and you have actually provided them with software and hardware that meets their needs from the purposes of their job responsibilities.
Mhm.
All of these things were new to us before we started going through accreditation. I'll be very honest, the first set of accreditation we went through was very, very difficult for us because we were developing all new policies and procedures and making sure that they all tied together and worked together in a way that was going to be acceptable within our workflow. And we've implemented all kinds of different committees that meet on a regular basis so that there's input from the entire company into our security posture, including our board of directors. And so I would say that it's really quite true that everything at KONZA, from policies and procedures, even to technical assurances and monitoring, have changed because of our accreditation.
Thank you. And you've already given some wonderful examples as well of how accreditation kind of raised the bar for your team as you do all of your work across policy, governance, et cetera, and the technology. Well, I have one final question for you. Why does it matter that Direct Trust is your high trust assessor?
Well, we have been working with DirectTrust for many, many years, and it has been always a very positive and professional relationship that we have maintained with DirectTrust. And we began working with DirectTrust when we began our HIE accreditation through ENAC, our HIE accreditation. And that set the standard for us for really our privacy infrastructure. So we think about this in two different ways. You have a privacy infrastructure and a security infrastructure, and then really also a compliance infrastructure as well. But in particular, DirectTrust and the ENAC accreditation helped us establish our privacy infrastructure and really helped us be able to align the privacy of all of our policies and procedures with what would be considered industry best practices. And so when DirectTrust actually began working with HITRUST, it was a natural extension for us to continue doing our HITRUST accreditation through the DirectTrust relationship that was established there. And then over time, DirectTrust has added other products and services that have helped us in addition, particularly around credentialing. So DirectTrust is truly a trusted partner for us. We look to them really to make sure that the policies and processes and procedures that we have in place are best of breed, best in the market. And so I think that I can always count on them to let me know if there are changes or updates or some sort of configurations that are going to be necessary for us as a company ahead of time so that we're not caught off guard by any new changes that might have happened. So we've been working with DirectTrust for a very long time and consider them a key partner of ours.
Excellent. Thank you so much for your time and your feedback. In healthcare, saying you're secure just isn't enough these days. You need to be able to prove it. Your payers and partners need evidence, and Direct Trust accreditation and high trust certification delivers that assurance. For more information, please go to directtrust.org or even download criteria for accreditation at accreditation.directtrust.org.